A good day to everyone. We are from Group 4 and we would like to discuss about the opportunistic infections caused by the protozoa. Here is the list of our members. So we are going to discuss about the 4 types of infections caused by the protozoa. Firstly, toxoplasmosis. Secondly, cryptosporidiosis. Thirdly, giardiasis. And lastly, trichomoniasis. I would like to start off with the first type of infection, which is toxoplasmosis. So as the name suggests, the causative agent is the Toxoplasma gondii. So it is a kind of parasite. So how can the host get infected? It is through eating undercooked and contaminated meat, drinking contaminated water, and for pets owner, they might contact with cat feces. Well, for congenital transmission, the mother passed the infection to the baby during pregnancy. And lastly, receiving an infected organ transplant or infected blood through transfusion. But this case is very rare. So regarding the pathogenesis, after the parasite invades into the host cell, the parasite replicates actively and causes the host cell lysis, and necrotic foci may result. The congenital infection often involves the retina and brain, so that's why it causes the impair in vision, and large necrotic abscesses may appear in the brain of immunosuppressed patients, and the disease reactivation in immunosuppressed patient may result from the rupture of a tissue cyst.
Hi everyone, now I would like to talk about the symptoms. So in most cases of the animals and human infections, toxoplasmosis does not cause any of the symptoms. It is asymptomatic. And the only evidence of infection is detections of antibodies in the blood against of the toxoplasmosis parasites. So the general symptoms included fever, headache, muscle pains, eye inflammations, swollen limb glands, heart muscle inflammation, and also the lung inflammation. Now I would like to discuss about the diagnosis. So we can use the serologic test to measure the presence of immunoglobulin G and to determine whether this person is infected with the toxoplasmosis or not. And also we can use direct observations of the parasites in the stained tissue sections, cerebrospinal fluid, or other biopsy material. And the third one, we can use molecular techniques that can detect the parasite DNA in the amniotic fluid can be useful in the case of possible mother-to-child transmission. The treatment plan included the usage of pyrimethamines with sulfadiazines and also leucovorin to prevent the bone marrow suppressions. Pyrimethamine selectively inhibits the dihydrofolate reductase of the plasmodia, and it will block the biosynthesis of the purines and pyrimidines, which are essentials for the DNA synthesis and cell multiplications. We can also use clindamycins or atovaquone with the pyrimethamines when the patient is allergic to the sulfonamides or does not tolerate the sulfadiazines. Remember, there's no treatment is required for immunocompetent patients who are asymptomatic or have mild or uncomplicated acute toxoplasmosis.
Hi everyone, let me continue with cryptosporidiosis. As the name stated, the causative agent is Cryptosporidium flavum. It is the most prevalent species from Cryptosporidium causes the diarrheal disease cryptosporidiosis in humans. The route of infection include the ingestion of contaminated water, direct contact with infected animals or their feces, or even person-to-person contact or foodborne transmission.
So next is the pathogenesis. So first, the invasion of intestinal epithelial cell. The parasite will replicate within the host cell, and the infected host cell will rupture, releasing the merozoite that will infect the neighboring cell. which will cause the inflammation and damage to the intestinal mucosa. The inflammation and damage will result in diarrhea and dehydration, which is the main clinical symptoms of cryptosporidiosis. This will lead to the infected host cells shed millions of oocysts in the feces, which will cause contaminate water sources and perpetuate the cycle of transmission. So for the symptoms of cryptosporidiosis typically appear 2 to 10 days after exposure to the parasite and may include watery diarrhea, and this is the most common symptom and can be severe. Next, abdominal cramps and pain, dehydration, weight loss, and fever. So in immunocompromised individuals such as those with HIV, AIDS, or undergoing chemotherapy, the symptoms may be more severe and prolonged.
Now, we are moving on to the diagnosis, treatment, and prevention of cryptosporidiosis. The first one is diagnosis. There are several ways for us to diagnose cryptosporidiosis, which are microscopically identifying the presence of oocysts by acid fasting staining, which is the modified Ziehl-Neelsen stain on unconcentrated fecal smears where the oocysts stain red and bright yellow. Next, we can also do the immunochromatographic assay for detecting Cryptosporidium oocysts in stool sample. And lastly, using PCR detection of Cryptosporidium. Next, the treatment of cryptosporidiosis, which are nitazoxanide for people with healthy immune system and azithromycin, which is for immunocompromised patient. Now, there are several ways for us to prevent this disease, which are by washing our hands after using the bathroom, wash hands after contact with farm animals, pets, animal poop, and animal environment. Do not swallow water while swimming, and do not drink untreated water from lakes, rivers, ponds, and streams.
Next, I'm going to present about the opportunistic infection caused by giardiasis. The causative agent for this infection is Giardia intestinalis. It is the most commonly identified intestinal parasite, and it is the most common protozoal intestinal parasite isolated worldwide. And this infection is more common in children than in adults. Giardia intestinalis can cause asymptomatic colonization or acute or chronic diarrheal illness. The organism has been found in as many as 80% of raw water supplies from lakes, streams, and ponds, and in as many as 15% of filtered water samples. Next is the route of infections. So these infections can spread through the person to person or through the contaminated water, food surfaces, or objects. And the most common way people to get sick is by swallowing the contaminated drinking water or recreational water, for example like lakes, rivers, or pools.
Next is the pathogenesis of the giardiasis. This Giardia intestinalis infection, it will cause the enterocyte damage and the loss of brush border of the epithelial cells. This will lead to the shortening of the microvilli and also the outer epithelial barrier functions. And this is all due to the result from the attachment of the Giardia trophozoites, which is the form of Giardia intestinalis in the feeding stage. And it will cause the activation of the immunoresponse, which the bacterial products will influx into the epithelial cells and the T cells will be activated. This will cause the injury to the brush border, which leads to the malabsorption and also diarrhea. And this pathology will result in the aqueous diarrhea, statodria, nausea, abdominal pain, vomiting, and also the weight loss. The Giardia infection, which is the giardiasis, it may cause a variety of symptoms, which includes the diarrhea, gas, foul-smelling greasy poop that can float, the stomach cramps, nausea, and also dehydration.
Next, I'll be talking about a disease called trichomoniasis. Trichomoniasis is a very common and treatable sexually transmitted disease which is caused by the infection of a protozoa called Trichomonas vaginalis. Trichomonas vaginalis is an anaerobic, flagellated protozoan parasite. For its route of infection, this protozoa passes between people through genital contact during sexual intercourses. So this includes vaginal, oral, and anal sex. So this disease can pass from a woman to a man to a woman, or even between the same genders.
Next is pathogenesis. It is a common and curable infection. Its name comes from the parasite Trichomonas vaginalis, which causes this infection. It spreads during sexual intercourse, which is in semen and vaginal fluids. The parasite mediates adherence to epithelial cells to colonize the human host. And for the modes of pathogenesis, it includes damage to host tissue mediated by parasite killing of host cells. Second, destruction of steady-state vaginal microbial ecology. And the last one is eliciting inflammation by activating the host immune response. Next, for the symptoms, although it is uncommon, the symptoms for male is frost-like discharge from the penis, burning after ejaculation or painful urination, irritation or itching inside the penis. And for women, thin or sometimes foamy white, yellow or greenish vaginal discharge that has a bad odor. Irritation, soreness or redness around the opening of the vagina, and pain or discomfort during intercourse or when peeing.
So for diagnosis for TREACH, there will be two, which is the physical exam and the lab test. So for physical exam, there will be genital examination and pelvic examination, where your discharge will be collected through using cotton swab during this exam. And during pelvic exam, if your pelvic look like a strawberry, that means you have TREACH. While for lab test, a vaginal and penile discharge are observed under microscope to detect signs of infection. So for your information, if you have TREACH, you'll be examined for STIs too. And if your partner is guaranteed to have TREACH or have any infection, you will be given antibiotics directly, immediately, without any examinations, so to prevent any infection. So the treatment that can be done to treat TREACH. So the first one is that they will be given antibiotic medication like metronidazole, and the second one is tinidazole. And this antibiotic is given to kill the parasite infection. So the side effects of this medication is that the first one is nausea and vomiting, rapid heart rate, heartburn, and metallic taste in your mouth. So for your information, TREACH is curable. TREACH doesn't go away on its own. You need antibiotic to treat them. So please treat yourself if you have TREACH. Thank you.